Hello, good afternoon. Thanks for joining us today. We appreciate you taking time to tune in to the broadcast today. I hope you had a good holiday. I hope you made it through Thanksgiving okay and your football team did okay. My football team did not do okay, so some of us are happier than others, I'm sure. But it's a good time of year. We're looking forward to holiday season coming up. We actually have a fairly quick turnaround on the holidays because we had such a late Thanksgiving this year. Our state committee meeting, State Committee of Public Health, actually meets next week, which is pretty early, so we only had about 3 weeks in between our meetings. When we do these broadcasts, I like to tell everyone just a little bit about what the state committee has been working on. The state committee, as you know, is our overseeing board, and we've had several things during the past month or two that I wanted to mention to you. First of all, Alabama restaurants can sell you wild harvested mushrooms, so that's exciting. If you enjoy those the same way I do, I'm really looking forward to that. That's a first for our state, and our environmental folks spend a lot of time working on those rules and regulations, but now that will soon be possible in Alabama. We also were very excited to present to the state committee this past month Alabama's first state oral health plan. And I can't really show you much of this in the booklet here on camera, but I hope you'll take a chance to go online and look at this. This is available on our website. And this is a tremendous effort that was put in by our oral health program, by Dr. Tommy Johnson, and by the other folks in Family Health Services. This has been many years in the making. As recently as 2016, Alabama was ranked number 50 out of 50 states in terms of oral health. And this report had never been done before in our state. The main reason we were ranked so low is that we never had a state oral health plan. In 200 years as a state, Alabama's never had a state oral health plan. So just based on the framework of putting this together, the most recent ranking had Alabama about number 29 in the country in terms of oral health, and that really represents oral health rankings. And so that really says a lot for the time and effort that they put into this report. One of the interesting things about reading this that you learn about is that oral health is just like every other kind of health. Oral health is health. And so much of the issues we have with oral health in Alabama are related to the social determinants that we see in every other health problem. So many health disparities we have are tied up in those determinants like race and income and educational attainment, and even just where you live, what your zip code is. And oral health is no different from that. So again, thanks to everybody for working on that, and I would encourage you to take a look at that document if you get a chance. Another thing that the state committee has been working on recently has to do with making a statement on cannabis legislation. As you probably know, there are more than 30 states in the U.S. now that have laws that allow for medical use of marijuana or cannabis derivatives. Alabama has not had that before, although there's been some proposed legislation for the past couple of years to try to bring that about. So this fall, we actually had a commission that was established by the legislature that had public hearings, that had medical experts from all over the country and even from out of the country come in and talk to us about medical cannabis. The idea is to try to develop some sort of framework for if Alabama should adopt this, and if so, how it would be adopted. So our state committee wanted to actually weigh in a little bit on that, and they actually approved and issued a statement this last month, and I'll just read a portion of it to you. Our state committee said, the State Committee of Public Health and ADPH do not support the legalization of marijuana for medical use except through the normal U.S. Food and Drug Administration process. And so that's kind of a political statement in a way when you have such a charged issue. There are people on all sides of that issue. I think the view of our committee and the view of public health, I think, and even my own personal view, is that for physicians who want to treat patients for a specific diagnosis, you really need solid medical evidence telling you what you can and can't do. The real issue that has arisen with medical marijuana is that many states just use it for anything that anybody wants to try to use it for. And I don't think our committee feels, and I don't feel that that's really an appropriate way to issue medical guidance. So we do have certain prescription drugs that are on the market now that are derived from cannabis, derived from marijuana, and those are available because they've gone through the normal Food and Drug Administration process. And people understand their safety, they understand the potential for drug interactions, they understand how well they work and what they work for. And so sometimes we get to the point where we get involved in politics, but we really never want to be partisan. We're not trying to take a position on a specific legislation. We just want to use the science that we have to make the best informed decision and make sure that we're representing what science really tells us to do. So you'll hear a lot more about cannabis legislation in the next few months, particularly this upcoming legislative session, and we'll try to keep you informed on that as well. I had a few other things I wanted to mention to you. We finally managed to get through our budget roll-ups, and many of you know about this. Budget time is always kind of fraught with anxiety and concern and where are we heading and what are we going to do. We actually feel like we have a really good path forward now. We do have a little bit of a spin down that we anticipate, but it's very manageable. And that's due really to the great work that's done by all of you out there, by your administrators, by the folks here at the central office as well, who went through their 1, 2, 3 plans, who gave us suggestions about ways to control costs and ways to control spending. And we really feel like we're in great shape for this coming year. We do have some changes, as you know, and changes always make people feel a little nervous or a little anxious, and I can certainly understand that. But we're still going to continue to have a county health department open 5 days a week in every county. We're going to continue to provide the great services that we do. And even though we may be sharing personnel a little bit more between counties, or maybe not filling some positions that we had hoped to fill earlier, we know that we're going to be there because people are always going to need public health. Public health is always going to take care of people that have no other place to be taken care of. We know that that need always exists, and we want to do everything possible to try to meet that need. So we feel very good about this upcoming year. We're going to need resources this next year as well, and that's a lot of what I've been doing over the past several weeks. We've met with numerous legislators. We've met with folks in the governor's office. We've met with other officials, including local officials as well, and we are making our case for why public health deserves support. And we feel like that they hear us and understand us. You never really know until the budgets get done, you know, in about 6 months from now, where we're going to be. But we feel like we've done a really good job representing the importance of public health, and we'll certainly keep you informed on that. In the meantime, I want to thank you all for putting up with all of this process. Again, I know that many people it can be kind of frightening and worrisome and what's going to happen, but we feel like we're in a good position now, and it's thanks to all of you for chipping in and shouldering the burden and helping us get through that we are where we are. We do have some other interesting things that are going on right now. We have just recently begun a rollout of a program that's related to our CHIP program. All of you have heard of All Kids, which helps to provide health insurance for low-income kids in Alabama. But we have a program that's related to that we have termed All Babies. And All Babies program is one that helps to provide insurance and prenatal care as well as other services for low-income women who don't otherwise qualify for Medicaid. So we are just starting it now in 3 counties as a pilot program here in Montgomery, Macon, and Russell counties. We've already had women who have been referred to us who don't have insurance, who aren't eligible for Medicaid, but who are pregnant. And we are getting these women insurance that will allow them to see a provider and get prenatal care, but also connecting them with our social workers that can provide a number of sort of wraparound services to help meet a lot of the needs that these women may be having. We know that one of the most important ways to prevent infant mortality, to prevent babies from dying in that first year of life, is to make sure that these moms are taken care of even before the babies are actually born. And so we're very excited about the program. We appreciate all the work that CHIP has done on that, and we'll let you know more about that. Our goal would be someday to roll that out statewide, not to have it only in these counties, but to do it statewide. And we feel like that it's a great example of good things that we can be doing in public health. We continue to have a hepatitis A outbreak, as you may know. It originally was clustered in the northeastern part of the state, but now has spread to 15 or maybe more counties at this point. We are doing some recalculation of our numbers, and we expect to see continued cases to go on for some time. Hepatitis A has been in an outbreak situation throughout much of the country for the past 2.5 years. It got a little bit late to Alabama, but now we are right in the middle of it. And as many of you know, I know you're involved in these efforts to reach out and try to immunize people against hepatitis A. The population at risk are folks that are sometimes hard for us to reach. many of the people at risk for Hep A are people that have been in prison. They're people that have substance use disorder. They're people who are homeless. And these are folks that don't always come in contact with public health every day or any kind of health care every day. And so we have folks who are working very hard to try to connect with those folks and try to protect them through immunization. So again, we'll keep you informed on that. It's not a subject that gets a lot of play in the press, and it doesn't get a lot of sympathy from the public when it does get play in the press. But we know it's a very important role that we play in trying to protect people against illness. So more to come on hepatitis A. Those are really the main issues that I wanted to talk to you about today. I did want to wrap up just talking just a moment about our sort of mission, vision, values plan that we developed in the past few months. I know sometimes when we do this sort of corporate speak and talk about these sort of buzz phrases that it can make you roll your eyes a little bit, but we've actually had a lot of input from many folks throughout the agency in developing these core values that you see in front of us, and I'm really very proud of how we were able to come up with this group of values. The concepts of excellence and integrity and innovation and community are core values that aren't just things that we aspire to and things that we want to achieve, but they're really actually the qualities that people who work for ADPH already possess. And I think about that all the time when I see this list. These represent sort of the best qualities of the people I know who are our best employees, and I'm very proud to be part of an organization that has people that do such great work every day. We have a mission to promote, protect, and improve public health in the state, and we really do that kind of one person at a time. We do that through our interactions every day with our coworkers, but with the public, and with every person we see, and with everything that we do. I appreciate so much the opportunity to work with this organization. I really do enjoy getting up out of bed every day and coming to work here. I've just been here a couple of years at this point, but I really feel like I have a home here, and I'm very proud to be part of this. So again, thank you for all you're doing. I appreciate all the great work that you do. I hope you all have a great holiday season, and look forward to any questions that you have at this time. We'll be glad to answer those. Thank you. Okay. All right. All right. If we don't have any questions, we'll wrap up, and I hope to join you again soon. Thank you very much.